Good morning, everyone. My name is Emmanuel, and I am pleased to present on emotional health and its importance in UK social care. Today, we will explore how emotional well-being impacts on both service users and care workers, examine current initiatives, and recommend strategies for improvement in care settings. Let's move to the next slide. Here, this slide discusses, gives a brief explanation on emotional health in UK settings. Emotional health represents a cornerstone of effective health and social care delivery across UK settings. It is not merely an adjunct to physical health but forms the foundation of person-centered care approaches. Current statistics, as it is displayed on the slide, current statistics reveals concerning trends. 46% of care home residents exhibit depression symptoms, while 78% of care workers report emotional strain. These figures highlight the dual burden affecting both service providers and recipients. Moving forward, emotional health directly influences physical outcomes, with research showing emotional well-being support can reduce recovery times by up to 37%. The CQC has increasingly recognized this connection, evolving from basic acknowledgement of incorporating emotional well-being as a key assessment criterion within their inspection framework. Then here we'll move to the next slide. Let's move to the next slide. The second slide talks about impact of emotional care. Research clearly demonstrates the profound impact of emotional well-being on healthcare outcomes. Studies shows 65% faster recovery rate when emotional support is integrated into care plans, with medication requirements reduced by 42% in many cases. Here you can see the relationship as displayed on the slide, the relationship between service users and care workers. Here it is demonstrated that the relationship between service users and care workers is profoundly bidirectional. When care workers experience positive emotional well-being, they demonstrate enhanced empathy and reduced burnout. Simultaneously, when service users feel emotionally secure, they engage more actively with their care plans and develop stronger therapeutic relationships. These implications of the financial implications are substantial. NHS England estimates 3.2 billion in annual cost from staff turnover related to emotional burnout. However, investment in emotional well-being programs shows an impressive return, with every pound invested yielding 4.5 in benefits from reduced absence and improved outcomes. From our case study here, which is a Manchester Care Facility, if you take a look at the slide, you will see that the Manchester Care Facility case study provides compelling evidence with their 12 months emotional well-being program, reducing staff turnover by 32%, while improving service users' satisfaction by 47%. Here, let's move to the next slide. This slide talks about current initiatives. The current initiatives. NHS England has developed several frameworks supporting emotional well-being in care settings. Their comprehensive emotional well-being framework provides standardized assessment tools, while the person-centered emotional care pathways offer individualized planning templates. The care workers' emotional resilience toolkit has proven particularly effective for staff support. Here you see the mental health first aid training, how it has improved and affected the workers. Here the mental health first aid training has equipped over 128,000 care workers since 2020, focusing on early recognition of emotional distress signals and appropriate intervention techniques. Facilities report 87% improved response to emotional needs following staff certification. Here, the technology has also influenced emotional well-being. Here, digital initiatives continue expanding, with the NHS application library now featuring 42 validated emotional well-being applications. Virtual support communities offer peer networks for care workers, while remote assessment tools facilitate early intervention. Here we also talked about implementation. This implementation varies between regions. Implementation varies significantly across regions, with comprehensive support ranging from 65% in Scotland to 83% in Southern England, highlighting the need for standardized national approaches. Slide 4. Here we talked about the best practices for emotional support. The best practices, here we have the first one, person-centered assessment. Person-centered assessment forms the foundation of effective emotional support, identifying individualized emotional needs through structured approaches. This connects directly to creating supportive physical environments designed to promote well-being through thoughtful space design. Number 2, we have effective communication. Effective communication techniques foster emotional security and trust, particularly important when working with vulnerable individuals. Regular monitoring should be integrated into routine care processes rather than treated as separate from physical health assessment. The next one, we look at intergenerational activities. Intergenerational activities have demonstrated particular effectiveness in promoting meaningful social connections, reducing isolation while improving mood and cognitive functions among service users. These best practices, because of our time, I will not be able to take all of them as displayed on the screen. So these best practices collectively embody key principles of dignity, respect, choice, dependence, and personalization that should guide all emotional support initiatives. Then we move to this slide talks about recommendations for improvement, things that we should do to improve emotional well-being in UK social care. Our recommendations follow a logical implementation timeline from short to long-term actions. First, policy reforms. Policy reforms must elevate emotional well-being to equal priority with physical care in regulatory framework, supported by reversed funding models incorporating emotional well-being metrics. Number 2, training needs. Training needs represents our second priority, requiring standardized emotional support training for all frontline staff through a comprehensive competency framework. Another one is technology. Number 3, technology. Technology solutions offer significant potential through digital platforms for monitoring and interventions, particularly through integrated assessment applications suitable for diverse care settings. Number 4, community. Community engagement model can combat isolation through structured social prescribing pathways, connecting service users with emotional support resources. Finally, implementation. Implementation should begin with 90-day pilot program in selected care environments to evaluate effectiveness before broader rollout. Let's move to the next slide. So this slide brings this presentation to a conclusion. I hope this presentation has highlighted the critical importance of emotional well-being in providing truly person-centered care. As we have seen, emotional health is not merely an optional extra, but a fundamental requirement for quality care provision. I welcome any question you may have about the content we have covered right now, or the regulation or initiative that we proposed. Thank you so much for your time and attention. Have a nice day.